and pleasure to welcome you all to this healthcare webinar on building a profitable healthcare business in Nigeria. As we all have observed, there's been quite a lot of development and some progress within the healthcare space, especially post-COVID, where we see an increase in number of healthcare facilities, hospitals, diagnostic centers, and even chain pharmacies. We also note that the landscape is changing and there's increase even from the diaspora with healthcare professionals coming home to render service within this space. Within that sector, there are also quite a few challenges that present, which is one of the reasons why the Lagos Business School has deemed it necessary to look very closely at this sector and roll out initiatives within the healthcare space. During the course of this webinar, Dr. Arinze Mokolo will shed some light and provide insights into plans that we have to further support and build capacity within this area. Today, we will have a very eminent panel that will be speaking across this spectrum and shedding light and perspective around how you build a sustainable healthcare practice within this space. We have with us this morning Dr. Doyin Salami, who is a very well-respected leader within the space, who has a wealth of capacity around the economic environment, having served within the public, the private, as well as the developmental sector space, providing his insights and his expertise to help build capacity. He has had the honor to serve at the highest level, advising the presidents. The former President Buhari had him as the chairman of the Economic Advisory Council, and he's an international expert and consultant who has served providing advice to bodies such as USAID, DFID, as well as UNIDO. Please join me to welcome Dr. Salami to this session. We also have Dr. Ugo Obichukwu, who is the founder and partner of Diametrics Financial Advocates. He is a thought leader in his own right, an accountant with over 18 years of experience, well respected in the space, providing and pioneering thoughts within the personal financial advocacy as well as financial analysis. He has a sound grasp of the Nigerian economy and will be lending his voice as to what we can do within Nigeria and what he has seen based on his experience. Also speaking today would be Chidi Okoro. He's an adjunct faculty within the Lagos Business School with expertise in strategic management and a vast wealth of experience across several sectors, including healthcare, telecoms, retail sector, as well as manufacturing. He has provided advice to investment corporations, especially within emerging markets, and supports the creation of value within the portfolio companies. We will go right ahead and start off with Dr. Doyin Salami. He will give us some thoughts around the Nigerian macroeconomy as it relates to health systems. Dr. Doyin Salami, you have the floor.
Yeah, so as I was saying, it's a pleasure to be able to share thoughts on where the Nigerian macro is at the moment and what implications, if any, it has for the health, for Nigeria's health sector. So I'll just share my screen and hope that you can see what's on my screen. Can you see my screen?
Yes, sir.
Okay, right. So let me summarize where things are. I will use my deck, just to illustrate a couple of points, but the deck will be available post this event for whoever is interested. Now, as far as the Nigerian economy is concerned at the moment, it's in the process of reform. It has started the process of reform, and the challenge that the economy faces is that reform as with any reform, has destabilized the initial equilibrium, and the economy is trying to get back to stability. Let me, and the process of getting back to stability is actually not that easy. If you just take a look at these two graphs here, stability has three components to it. Output must be faster than population, inflation should be lower on costs, and then the surplus in your external account. And what you can see here is, no matter how you look at it, we are far away from the sweet spot of stability. What we are hoping for is, as you can see in the graph on the right-hand side, there's a red arrow there somewhere, that we are hoping we have now turned a point of inflection, and hopefully things will continue to improve. So that's the first important thing to say, that economy, destabilized by the reforms, but the question is, are we on the path back to stability? The inflection that we see, as I said, in both graphs, but a bit more obvious when you look at the monthly data as opposed to the quarterly data, suggests that perhaps we have to wait and see that, how entrenched does that become. The further south it goes, the better for the economy. So that's the first point to quickly draw attention to. The second point that I would then like to make is, if you understand what the key drivers of the Nigerian is, let's just quickly take a look at what the key drivers of the economy are. The four global factors I always pay attention to: policy, global trade, global capital flows, diaspora transfers. But if you look at the map of Nigeria, at the heart of it, you will see policy, fiscal, monetary, and regulatory conditions. These, for me, are the key drivers of where we are and where we go from here. Now, there are a couple of, I'm not going to bother myself too much about some of these, but I would like to draw attention to a couple of key issues. The biggest challenge for the Nigerian environment right now is inflation. Growth is happening. It's not fast enough. Ordinarily, we would like output growth to be a multiple of population growth. By the way, we are not actually clear what population growth is. And this being the health sector, that's actually, like any other sector, it's actually a very important domain. But just look at, inflation for me is right now our biggest problem. And let me, try and illustrate or explain what you see here. So inflation is rising, we can see that. But if you look at that top row and you look at the graph in the middle, what you also see is that whilst farm gate or factory gate prices are rising roughly at about 13%, you can see that last mile prices or consumer prices are rising in excess of 30%. The gap between those two is essentially your route to market costs. So one of the key dimensions, around inflation at the moment is simply the widening gap between factory gate costs, in other words, producer costs, and consumer costs. And in there are, outbound logistics and other route to market costs that you can envisage. So that's one key issue to bear in mind. The second key issue to bear in mind, and this especially given my colleague Mr. Chidi Okoro's usual emphasis on what interest rates are doing and how it's hurting business. Take a look on the third graph on the one on the extreme right. You look at inflation, it's higher than returns. And what that, of course, means is that the Naira as an asset holder doesn't function. And which is one of the big challenges that the government is, in my view, trying to resolve by continuing to raise interest rates. Because for as long as market yields are below inflation, the temptation is very strong, not to hold assets in Naira, but to hold assets in pretty much any other thing, foreign currency certainly, and perhaps non-traditional asset classes, real estate, and alternative assets. But if you look below those two graphs, both the one on the left and the one on the right, let me start with the one on the right. What that says, it simply speaks a bit more to what I've just said about inflation and yields. If you look, Nigeria yields, which are in the green, are about 13-14% below inflation. But if you look at all the other countries against which I have drawn a comparison, their yields are higher than inflation. So you can therefore understand why asset holders in Nigeria may just prove to be more interested in opportunities abroad than opportunities in Nigeria. That's the first point. But if you look at the one on the left, and I think this is something we need to pay some attention to, because there's something in economics called the law of one price, which simply states that exchange rates will move to equalize prices in two different domains. So if you look at, the blue line is Nigeria's inflation, the green line is US inflation. Sorry, a bit of mischief at play there, using green for the US and blue for Nigeria. But the point to draw from this particular graph is that there is about a 30% gap between inflation in Nigeria and inflation in the US. And ordinarily, in the normal course of events, exchange rates should move to cover that. Now, I am not saying for a moment, not even considering for a moment to say that, oh, the exchange rate in Nigeria is about to move 30%, but I am saying that we need to bring down inflation in order that the pressure on the exchange rate should abate. So that's one of the big issues that need to be well understood as far as where Nigeria is at the moment. One of the things, I will come back to this particular table in a moment, but there's something which I would like to just quickly share before I go to the health sector. So inflation is a problem, but if you also look at the middle, the top line, the middle, there are two graphs that I would like you to pay attention to here. The top line, the middle. And as you see, the green unbroken line there is our output growth. Even though I say I'm not, we don't really know what population growth is about, is at. I've seen figures ranging from 2.5% population growth to over 5% population growth for Nigeria. But until we have a census, it's going to be very difficult to make any meaningful comments about that. But the green is what I'm actually interested in. Because at output growing slightly around 3.1%, it simply means that income per capita is also going to be sluggish. And for all sectors, health included, a sluggish growth in income will, of course, affect demand. But the other piece that I would like to draw attention to on this one is simply that, look, the fact that the economy is growing is a positive, is positive news. What we need is for it to grow much faster. And the reason for that is this. At these kind of slow levels of growth, the income that is generated will concentrate upwards. In other words, it will be those at the top of the pyramid who will get the bigger benefits. In fact, the kind of trickle-down effect that you would typically expect is unlikely in the course of a reform at this level of growth to be felt in the lower echelons of any income pyramid. So that's very, very important. The other very important piece, if you look at the graph on the second row on the left, on the extreme right, my apologies, on the extreme right. And what that shows is crude oil price, which is the broken line, and oil production. And we are seeing, in my book, Nigeria's short-term issues or solving Nigeria's issues in the short term will actually require for us to really move oil production significantly up. I am aware that the government is targeting 2 million barrels of crude oil per day by the end of the year. But in my view, we really do need to get oil up so that both the revenues, the government's revenues, and then availability of FX can also improve. Okay, so two issues already highlighted. One, inflation is a major challenge. Two, even though the economy is growing, the likelihood is that income is concentrating upwards. Three is that we need to resolve, get oil production up in order to resolve some of the more short-term issues that Nigeria kind of faces. Well, I've spoken about the exchange rate, but the other piece that I think is kind of important for me in all of this is to go, actually, this is something that I find a bit interesting. Just look at the graph on the left, and it's per capita income between Nigeria and China. It'd be very difficult to convince anybody if you didn't see these numbers that as recently as 1994, the income per capita in Nigeria was higher than the income per capita in China. And, as you can see, since then, the gap has grown, incredibly much wider. China is now north of $12,000 per head of population. Nigeria is struggling to get to and remain at $2,000 of income per head. Now, let me move on to begin to look at the health sector. All of this is, as I say, available to you as post this session. But let us look at the health sector. And what is pretty clear about the health sector is that as a contributor to the economy in Nigeria, it's actually pretty small. Its contribution to GDP is, it's a pretty small, as of now, it's a pretty small sector of the economy, even though but when you look at the growth numbers, again, the growth numbers, as you can see, are the broken line. The unbroken line are is its contribution to GDP. And by the way, the axis on the right-hand side is for growth, and the axis on the left-hand side is for contribution. And so you can see that this sector is contributing less than 1% of the economy's total output in terms of economic value added. And in terms of growth, the growth has slowed. As you can see, towards the left-hand side, the growth seemed to have, of the graph at the top, the growth seemed to have been quite significant. But since about 2015, the sector's growth has really come down, and it's growing. Only occasionally has it reached about 5%, in terms of growth. And that, for me, really does create a challenge. The other piece that I think is interesting, to pay attention to is costs within the health sector. The second row of this slide and the graph on the right-hand side does show very clearly that actually, relative to producer prices or producer inflation in Nigeria, the health sector's costs have actually lagged behind costs within the economy as a whole. Now, let me be very clear about what I'm saying. This is on the producer side. I am not speaking about the final markets, the final prices that consumers have to pay. And so what this is saying to me is that, ouch, there is, even though those who are producing for the healthcare sector in Nigeria, their costs are not rising as fast as other producers. But as you can see, those costs have been just, almost it's so ragged. That's the point. It's so ragged that predictability becomes a challenge. The other piece that I would like to talk to before I, yield the floor, we can come back to explore some of these in due course, is here. If you look at the demand side for health, there is so this is the consumer basket for Nigeria. And I've looked at it over 3 different time horizons: 2003, then what is currently the weights, and then the likely weights. As some of you who follow these things may know, the Bureau of Statistics is in the process of rebasing GDP, but it's also in the process of reviewing the weights for components of the consumer basket for Nigeria. And a couple of interesting things here. If you look, in 2003, Nigeria was essentially all what I can describe as a subsistence economy. Almost 68% of spend was on food, and non-alcoholic beverages. By 2000, by currently, that had dropped to 51.8. And if what we think the new weights are likely to show is correct, then it's further dropped. So food has released a share of pockets. And the question that may be interesting to this audience is, okay, so who are the key beneficiaries of this share of pocket? And guess what? Healthcare is one of the key beneficiaries in this share of pocket, because what you can see is that currently the weight of healthcare in the current basket is about 3%, having grown from 1.4% in 2003. But it's looking likely that by the time the new basket is published, healthcare, the spend on healthcare out of people's income will be about 6.1%. Now, question is this good or is this bad? Well, it depends on how one explains this. Is it that the sector, that the lack of government provision or the weakness of government provision now means people are having to spend more of their own income in meeting out-of-pocket health expenses? Or does it actually simply mean that we are seeing an evolution in healthcare such that the kind of coverage from the government sector means that, well, it's pretty much the same thing, means that we're spending more. But the key point that I think should be, that this data says, is that given from where we are, or from at least these current weights were done in 2009, to where we think we may find ourselves by the end of this year when new data is published, there's a doubling in the share of pockets that is attributed or that is devoted to healthcare, which in a sense is a very good thing. Now, the summary in terms of what I have said to you this morning are as follows. The economy in Nigeria is in reform mode. Reform necessarily is destabilizing, and the economy is trying to return to stability. The return to stability will depend on how quickly we can tame inflation. In order to tame inflation, sustainably in the medium to long term, you tame inflation by increasing supply. But in the short term, you can get some supply response. But in the short term, which is where the interest rate policy of the government has kicked in, is to try and tame inflation by reducing some of the demand side. Now, we can have a conversation about whether interest rates have a positive impact on inflation or not. I'm looking forward to that conversation. But what's clear is that we need to tame inflation. And without taming that, we are not going to get the kind of economic stability, even though what the data is already saying is that we may be at a point of inflection where the economy becomes more stable. Now, if that is the case, what we would then need to do is spur growth, get a growth spurt that enables output and therefore income to rise. As far as the health sector is concerned, it's a relatively small sector, but kindly bear in mind the following implications from where the macro is. The first is that, as I said, the economy is still growing, but the likelihood of what we are seeing in the absence of verifiable household income data across different strata is that my own expectation is that income is concentrating upwards. And so the trickle-down effect to the man on the street has not yet kicked in. Growth is not yet fast enough to be able to enable the average Nigerian to feel it. That's the first point. That's the second point. A third point is that given our challenge with inflation, the weakness of the exchange rate should not be misunderstood. That in economics, if your inflation is higher than your competitor countries, you will find pressure on the exchange rate. And in Nigeria, that is even worsened by the fact that not only is inflation high, but yields on financial instruments remain significantly below inflation, thereby making holding Naira assets or holding assets in Naira unattractive at this point, which therefore for me means that at the heart of Nigeria's strategy has to be a continuing battle to tame inflation. Unfortunately, the central bank has made very clear its intention to focus very, very squarely on inflation. But coming back, as I said, you have GDP growing, but concentrating at the top, inflation high, and that high, the high inflation, especially at the consumer end, is really because of route to market costs. As I showed you earlier, the consumer price inflation is way higher than the producer price inflation. And so the real challenge now is going to be, how do you manage route to market costs? I think on the whole, and I will end on this, I hope, positive note, where, as I'm arguing, that the new data on the consumer basket, how consumers spend their money, is showing that healthcare, its share in consumer spending has gone up from 1.4% in 2003 to 3%, currently, and the expectation is that will go further up to 6.1%. In other words, people are spending more of their own money in meeting their own healthcare needs. Now, is that a good or a bad position? It depends on what perspective you wish to take. But my view is that it certainly means that as income is rising, a larger share of that is coming into healthcare spend. But one question that this doesn't answer is that we would need to break this spend down according to socioeconomic classification to see whether it is truly across the entire socioeconomic groups or whether it is certain specific groups. So that generally are my thoughts about where the macroeconomic environment is and what implications it has for the healthcare sector. Thank you very much.
Thank you very much, Dr. Doyin Salami, for that very, very brief but concise presentation, speaking around the economy and from your expertise, laying it down for us. Please, we can have questions sent into the chat group. But Dr. Salami did speak about the reform, the drivers of the economy, obviously the inflation and the need to tame inflation, the widening gap between the factory gate and consumer costs, as well as the differential about 30% across the Nigerian naira as against the US dollar, the need for us to shore up crude oil production in the short term to address some of these issues, and our GDP per capita income, where you're seeing not as much growth as expected. The health sector contribution less than 1%. And very interestingly, looking at the consumer basket, which offers us some hope within the health sector, where we see growth 1.5 to 3 currently, with a projection of 6.1%. And so there is an increased spend within the health sector. How exactly that is to be spent is another discussion to look at, and whether this is good or bad, as he said, depends on which side you are. But it's very important to note that there is an increased spend by consumers within the healthcare space. I appreciate you, Dr. Salami, for that. We will take questions within the chat, but as we do that, we will very quickly call on Ugodre Obichukwu to tell us a little bit about trends within the Nigerian sector. Ugodre, you have the floor. Thank you very much.
All right. Thank you very much, Dr. Monica. If you don't mind, let me try and share my screen as well. Let me know if you see my screen.
Yes, sir. I can see your screen.
All right, great. Okay, let me try and see if I can get a pointer. All right. Good morning, everyone. Good afternoon, wherever it is you're streaming this webinar from. Great to hear Dr. Salami also end on a very positive note, because I know when we go for some of these webinars, things are pretty grim all around. So I'm just going to talk about the business side of things, the challenges, the healthcare sector generally, and then I will close with now what I call options for consumers and manufacturers. So let me just start with some key developments in the healthcare sector that some of you might not be too aware of. So quickly just run through. We heard in the news a few weeks ago that Fitzin had signed a major deal with a Chinese manufacturer to build a pharmaceutical plant around the Lekki Free Trade Zone area. Big news. Just yesterday, or I think a couple of days ago, the FG says is ready to implement zero VAT on pharmaceutical products. All geared towards lowering healthcare, prices. This is much different from the one we had, I think, some weeks ago, when the government said they were going to peg prices of pharmaceutical products, basically trying to control prices. I'm not sure how that has gone so far. Something else that was in the news as well was NAFDAC saying it was going to shut down 50 million naira counterfeit cosmetic operation plant. That's not the only one. We've seen several other fake producers all around the country. And this is typically what happens when prices are very high. People tend to bring in very fake products because purchasing power is pretty low, and people tend to look for cheaper items, even though most of them turn out to be fake. So government is busy chasing down on that as well. Another important data that we got was private hospitals. Private hospitals spending 40% of their income on energy, and some of them have asked for 100% electricity subsidy. I don't know who's going to give them that. Interesting data point that I also got was 58,000 doctors out of 130,000 doctors have renewed their licenses in Nigeria. A lot of them have jackpot. I'm sure we all know what jackpot means. And then, of course, we have 3,000 doctors produced annually. Again, most of them, after like the first 2-3 years, they essentially just leave Nigeria. We've also seen a rise in natural medicine as well, and they seem to be projecting 3 million jobs. Don't really know where or how they're going to get that, but that's also something that we've been tracking at Nairametrics. And then another interesting one, out-of-pocket expenses dominate our 75% of what Nigerians spend on healthcare. So basically, when they go to hospital, most of what they spend either on Medicare or on drugs, 75% of that come out from their own pocket. So it just shows you how the sort of gap we have in health insurance in Nigeria. So a lot of Nigerians just basically spend their own money on healthcare, right, and rely on health insurance. And of course, We've also seen a surge in DNA testing in Nigeria. Not sure why Nigerian men are worried about their paternity, but looks like that is what we're seeing. So, hey, that's probably an opportunity there somewhere. Another good news as well is me and Baker said they're hoping to they want to launch a bitter leaf capsule in Nigeria. Interesting thinking there. We've also seen a lot of healthcare companies coming up with different ideas just so that they can find better product placements that can meet the sort of demand that they see. We also had research suggest 22% of medicines in Africa are fake. Again, that is likely to rise because wherever you see high inflation, you tend to see a lot of people looking for cheaper products, and a lot of these products are fake. What else interests me here? I think Nigeria is partnering with US pharmaceutical companies with Pharmacopial for 70% local drug production. We're seeing that the current government as well seems to be pushing for local production of drugs. So there's quite a number of drugs that we can make locally here. I think there's also one news about EMSA. EMSA is also likely to launch its own very soon as well. So these are just some of the things that we have been tracking. And number 13 here interests me as well. The NHIA said it was going to increase the capitation that are paid to hospitals by 60%. And that has actually gotten a major pushback from HMOs. In fact, there's one other one that Lagos State government did mention and said they were going to get HMOs to pay, to give local, to give the health insurance scheme in Lagos some part of the premium that they get from insured customers, and of course the HMOs are pushing back and saying, well, why do we have to do that? And so a lot of interesting things going on in the healthcare sector this year in Nigeria, because a lot of times we tend to think there's not much happening, but we see a lot going on. Now, industry by numbers, I know I have like less than 15 minutes or so I'm going to try and rush this through. Interesting, I think Dr. Salami also touched on this. Nigeria's GDP healthcare-wise is 1.2 trillion. I'm sure a lot of people don't believe that, but based on GDP data, Nigeria's GDP size, about healthcare sector is 1.2 trillion out of 230 trillion as the size of the economy. That's like 0.7% thereabout. We're also number 24 when it comes to sectors in the economy. Healthcare, I think there are about 46 or so, for 47 subsectors in the economy. Healthcare is number 24. In terms of GDP growth rate, what is pretty interesting with GDP growth rate is that healthcare sector has been growing since 2020, since COVID, every quarter. I'm not sure I've seen any negative growth since 2020. So the sector has actually been growing, even though the last quarter it sort of lagged the general economy at 2.4% compared to 3.19%. In terms of the number of healthcare sectors that are quoted, that is listed on the Nigerian exchange, there are just about 7 of them out of 160, just 7 of them. We'd like to see a lot more healthcare sectors quoted. And one of the major ones, it used to be 8 before, by the way, until GSK left. So now we're just left with 7. Out of the 7, I think there are probably just 4 or so that are solid. When I mean solid, that at least valued at over 2 billion naira. So you can imagine total market cap of health and pharmaceutical companies listed on the Nigerian Stock Exchange is just 100 billion naira. The Nigerian Stock Exchange in total is valued about 56 trillion. So you can see it's just 100 billion naira. So long way to go for the healthcare sector. And if you don't have a lot of healthcare companies listed on exchange, then how will they be able to raise the sort of capital that we need, in our healthcare sector? Then in terms of revenue and profit estimate, we estimate that the healthcare sector would generate about 110 billion. That is on the exchange, because those are the only numbers that we can see. Healthcare sectors that are quoted on the Nigerian Stock Exchange, 100 billion, and a profit of 6.5 billion. What's interesting is that the healthcare sector has been growing by I think about 23% compounded annual growth rate. So it's a sector that has actually been growing over the last few years. It's just that when you compare it to the other subsectors in the economy, it's really paltry. So what's the overview of Nigerian sector? I think I already spoke to some of this when I was going through my news section. But the major thing that has dominated healthcare this year has actually been a rising cost of healthcare and pharmaceutical products. Interestingly, if you look at the MBS data, it tells you in the healthcare sector's inflation is about 22.5% compared to 33% for the economy in general. That is not what a lot of people experience. And I'm sure that people have seen healthcare pharmaceutical products more than double, right? In some cases, Some drugs have even increased by 1,000% from our own tracker. But I mean, inflation official record is 22.5%. So what has been the cost of rising Medicare in Nigeria? Now, important to put this into perspective, rising Medicare, cost of rising Medicare is not only specific to Nigeria. It's actually a global phenomenon. It's just that we experience it more for some of these reasons. Of course, inflation has its own impact on the prices of Medicare equipment or Medicare cost, or even pharmaceutical cost, because every single thing that affects inflation affects them as well. So that's why you've seen prices go up automatically. So whether it's pharmacies that have to pay rent, where they have their pharmacies open, that affects inflation. Cost of logistics or transporting goods from one end to the other affects cost as well. So they tend to increase. And of course, they also have to pay their employees. So these are all inflationary issues that affect them. Of course, exchange rate, everybody knows the impact of exchange rate on the cost of goods and services. Most of the things that we sell in Nigeria is largely imported, and even most of the equipment that we use in the healthcare sector is also imported as well. So that has a major impact. And of course, operating cost in general, whether it's paying electricity or diesel for operating your hospitals or your pharmacies or your labs, rent, these things all drive the increase or rising cost of Medicare. And of course, demand also has its own beat here. Now, bear in mind that as tough as the economy is, people actually get sicker, right? Because of a lot of mental health issues, stress levels are higher, people even age faster. So you're always going to see a lot of pressure or demand pressure on healthcare services. And this also has impact on cost as well. And of course, like I mentioned, it's a global phenomenon. I was just reading a report recently on global healthcare costs, and it's very interesting to see that it's actually not just in Nigeria. We're seeing these problems around or across the globe entirely. So that also means imported inflation comes into Nigeria, because as they also reflect inflation in these countries, and since we import most of the equipment that we use here, that has an impact on some of us, on what we do here in Nigeria. So what are the impacts? Of course, operational impact means hospitals are likely to face higher operational costs. Every single thing that hospitals use, whether it's gloves, syringes, PPEs, everything goes up. Salaries also have to go up. So because now healthcare employees have gone from spending 140 naira or so for fuel to 1,000 naira, they are going to demand for higher salaries. And no surprises here that we've seen doctors go on strike. You've seen nurses also want to go on strike. You've seen a lot of medical personnel want to jack out of Nigeria. These are all part of the operational impact that you get from inflation in the healthcare sector. And of course, financial strain is also a bit of a challenge as well, because then you're now in an economy where the central bank is trying to curtail inflation, and one of the tools that is using to curtail inflation is monetary policy. And so we've been experiencing a very hawkish monetary policy this year. And the message the central bank is essentially sending to everybody is like, look, this is not the time for you to borrow. We don't want you to borrow at all. So interest rates are pretty high. And so for hospitals that need short-term funding to continue to survive, they're finding it a bit more difficult as well, because interest on loans have also gone up. And I also mentioned pharmaceutical costs, so I don't want to go there. Pharmaceutical costs are off the roof now. And of course, equipment cost is also a problem, because whether it's equipment costs that are used for testing or where you go to labs to test, these things are all expensive. Even the cost of replacing the parts sometimes is even more than the cost of the cost that they used to buy the equipment before. So let's not even talk about replacement cost of the equipment itself. So these are the pressures that they are facing. So these things all have implications. It all means that people might not be able to afford Medicare anymore. So you're going to see a lot more Nigerians perhaps maybe want to face traditional, medicine or just self-care generally. You're seeing impact as well on insurance premium, because insurance premium is also going up too. So health HMOs can't continue to fund or pay for healthcare with the sort of insurance premium that we're getting 2-3 years ago. So you're also seeing insurance premium go up. And if insurance premium goes up, then organizations who are meant to provide health insurance find it difficult to fund that, because they provide health insurance for their staff. So that's a problem. Of course, Nigerians also have lower purchasing power So, like I mentioned, 75% of healthcare costs is out of pocket. So that is also going to be a problem, because with lower purchasing power, then people can't actually pay for healthcare costs. So that also affects the kind of investments that healthcare businesses want to make in that sector, because you're also looking at the purchasing power of Nigerians. Like, if I put all this money in here, are these guys going to be able to pay for it? So that is also a challenge. And of course, it also brings in delayed healthcare. So what are the barriers that most organizations face? Organizations face, capex. I already mentioned that it's a problem to generate enough funding now to fund the healthcare costs. So that is a problem on its own. Currency devaluation is also a challenge, because there are very few, particularly medical equipment. I like to focus on that a lot. There are very few medical equipments that we manufacture here in Nigeria, even though we do have some drugs that we make here. But medical equipment is a huge part of all of this. And so as the currency continues to get devalued, that affects, them as well. And of course, operational costs that they all face, and then limited access to capital. There are only about 8 healthcare companies that are listed on the Nigerian Stock Exchange. And so, you can only get access to public capital if you're listed. And there's not a lot of healthcare companies as well that are even listed on the FMDQ, where they raise debt capital. So most of them rely on private equity and family funding to sort of raise money, and that is not enough in terms of the skill that we need. And we actually need a lot of skill to even bring down healthcare costs, because that also affects how much money you can raise. If you can raise a lot of money at scale, then you can actually bargain better, and you can, that also helps reduce costs in general. Now, the government has also been trying to help to sort some of these things out. Permit me, because I had a healthcare theme with all my slides. So some of these things you're seeing is just so that I can just know mentally that I'm in the healthcare space. We've seen subsidies from the government. I just mentioned about the VAT one as well. So government has also been trying just to make sure that they can lower healthcare costs. We've also seen a lot of state governments going into their own healthcare schemes now. You've seen Lagos state government do it. I think there's one other state government in the north. So you're seeing state governments also trying to focus on health insurance as a way of solving the healthcare problems they have. We've seen a lot of PPPs as well, public-private partnership between government and private sector joining forces to try and build huge medical centers, all towards reducing costs. You've seen tax reliefs, incentives from the likes of the World Bank. I think there's also one major deal that Afrexim announced recently as well. You're seeing a lot of that go in either as incentive or as grants, and then huge infrastructure projects that are currently being conceived, not that they've been done yet, but these are just some of the things that the government is. And there's also a huge government plan, I think policy that the president also announced earlier this year towards fixing healthcare in Nigeria. Some of these things are still plans, because we actually haven't started implementing it yet, but it's important to know that, and the government recognizes that this is a huge challenge and an opportunity. I think that's an important thing to mention here. And that's why you're seeing a lot of state governments key in quickly. So I think the landscape of the healthcare sector will change a lot next year, because a lot of all these policies will start to get implemented next year. So how do companies mitigate some of this rising healthcare costs now? I just try to put up a number of things. I might not be able to go through them due to time, but I think in a nutshell, you need to have better operational efficiency and cost management for businesses. This is not a time to you for companies, organizations, the Medicare industry to spend irresponsibly. I think they should also try and explore bulk purchasing and local sourcing of items. There are a number of things that you need to do. Like, this is a time where you have to think out of the box. So things like gloves, I think that you can get local manufacturing companies to actually do these things for you, rather than always rely on importing some of these items that we can actually make here. That you don't buy it here doesn't mean that we can make it here. I think it was COVID that made us know that we can actually make face masks here in Nigeria, or even hand sanitizers, because before everything is basically imported. So I think that it's time to partner with local manufacturers to start to source some of these things. Of course, technology integration and automation is very important. Now, here, I know that a lot of healthcare organizations that have technology integrated into their system already. But what I tend to always stop with is that there is no value in integrating technology and automation if it doesn't bring any direct reduction in your operational cost. there is absolutely no value, right? So whenever you're introducing any technological integration automation, you need to be sure that that is all actually reducing your entire overhead or your entire operational cost. Pretty important, because sometimes you just go to a hospital and you see like 10 people in the front desk, all with computers. I'm wondering, why do you have to have 10 people there? Why can't you just have 2? So I think that technology and AI and stuff like is meant to help reduce costs, not increase it net. And of course, strategic partnerships and collaborations across the entire value chain is very important, especially now that there's rising inflation. And of course, preventive care focus is important, because the less people fall sick and then the more hospitals make, particularly from capitation. And so that is something that they should focus on as well. And of course, cost sharing with patients is very important. Not all patients can afford some of the medical costs out there. So hospitals, there are some hospitals that are actually thinking better in this direction. Some of them have started to introduce tiered pricing, trying to separate between basic things and premium things, so that you can get a lot more people afford healthcare. I think it's also very important that hospitals are partner with HMOs to increase awareness for health insurance. I kind of think that hospitals leave that only to HMOs. I think this is about time they collaborate. I need to see a lot more adverts on TV or radio making noise about the need to buy health insurance. Just shocking that even a lot of startups don't even know about health insurance, and that you can actually buy good health insurance for your employees. And I think that is what the industry is now. As consumers, I think more importantly, preventive healthcare is very important. You should check yourself regularly. You should start to adopt healthy living standards, because the stress levels is not easy now at all. So this is the best time to do that, because that just helps you prevent going to the hospital. Health insurance is very, very important. I think it's still the cheapest way of safeguarding yourself. Yes, I do know that you can pay for health insurance and not go to the hospital at all, but I think that it's still a better bet for you. Community healthcare is always important, especially in the rural areas. And I think for those of us who can support some of these initiatives, let's try and support it, because if your loved ones in the village are healthy, then that's less pressure on in your pocket. And of course, negotiating cost is also one of the things that we must do as consumers. We must constantly try to get better bargains with our hospitals, with our pharmacies, with our HMOs as well. Because at the end of the day, the only way we can reduce the impact of inflation is if we all find a way of spreading this cost across each other. So that is my presentation. I tried to make it as quickly as I can. I hope I didn't take too much time. Thank you very much.
Thank you very much, Ugo Obichukwu. Awesome. Thank you very much. And took us through some of the key things happening within the space. A very nice summation. Definitely saw how product development, the natural medicine space is featuring local production and the impact of inflation, where you have fake products, which is sometimes the bane when you have inflation coming up. What's happening within the insurance, health insurance and capitation, out-of-pocket spend at 75% for our consumers, and definitely a lot of work around the capacity strengthening within the health sector. Very important to note that we're number 24 when you look at the sectors as relates to healthcare and the economy. And growth noticed post-COVID, as I had mentioned, 2020 was like a wake-up call for us all. But very interesting to note, we currently have only 7 companies listed on the stock exchange out of 160. And we have a 6% compound growth compared to other sectors. The rising cost of Medicare, the global phenomenon, inflation, operational costs, increased demand are featuring within our space, as well as the impact of government policy, which is recognizing that there is a need to have policies across which impact federal and state governments are alive to that responsibility, looking at their insurance schemes. PPPs are on course, and the subsidies, whether tax reliefs or incentives, as well as infrastructure projects, are ongoing. Implementation definitely needs to be driven more. But there is definitely recognition within the public sector that there is a need to drive policy in this space. He spoke also about mitigating costs and ensuring operational efficiency and cost management, recommending bulk purchasing, local sourcing, use of tech and automation, and a very nice comment about tech, where you make sure that integrating technology actually brings a decrease in your overhead or your operational costs, which is very, very key. Important to talk about strategic partnerships and collaboration within the space, a focus on preventive care, which is just very, very nice to hear that, because I focus a lot on wellness and self-care, and we've realized that preventive care is actually very, very key to help mitigate costs, as well as cost sharing with patients. So self-care is something that needs to be looked at. And the barriers, he spoke obviously about the capex, ongoing devaluation, limited access to capital, and the need for us to scale within the health sector. So thank you very much for that very nice presentation. I think there's still a lot more to discuss, but I'll hand over to Chidi, and again, remind you to please send in your questions to the chat box, and Chidi will take us through business and profitability within the sector. Thank you very much.
Good. Yeah, thank you. So what I'll try to do is to thank you, welcome everyone. I just want to water the ground a bit, put some of my thoughts out there based on some of the conversation Dr. Doyin is put out, and also what Ugo has put out. They put out the financial, but at the end of the day, it has to turn to profitability of the business. If we're not profitable in the sector, we're not able to reinvest. So what happens over time, we die off again. If you go back in Nigeria, probably 30 years ago, healthcare did try to take off. We even had hospitals listed on the stock exchange. We had big, they were coming and suddenly faded out, including pharmacies, diagnostic centers, but they all faded out. And now I think we're on the cusp of another growth. COVID did open the door for healthcare. COVID did, and I think Dr. Doyin mentioned that, as well as Ugo as well. COVID did open the door. You saw avalanche of hospitals opening up, and many of them are now in chain. They have chains. Many are quite large, foreign investment coming in. You have HMOs all over the place. They're here. I think Ugo made something very important. Let's note that. I will speak to that when we speak about profitability, because this is a business we're running. How many HMOs really do the marketing the right way? How many pharmacies do the marketing the right way? I know there are regulatory issues. How many hospitals would do that as well? You also have diagnostic centers. Some of them are actually in 36 states of Nigeria. You have very large ones, very mega ones all over. So what happens is, in this kind of industry, at the end of the day, you do have just a few winners and many losers. And I think that's the crux of my presentation. How do we start to have a lot more winners in the space than losers? So this, I will not dwell on this, but our ventures are set up on assumptions around the economy. That's what we all do. We all think that GDP per capita will continue to rise. We think that consumer spending will continue to rise. And I will speak about Portal's 5 forces. This is an industry where it's so easy to enter. It's so easy. Barriers are few and far between. We speak about regulation. They are not really barriers. You and I know that. You don't even know who you're competing with in healthcare sector, whether you're in hospital or diagnostics or pharmacy. You don't know who you're competing with. At the end of the day, the HMOs all over the place. Now you have people building care plans, competing with HMOs. They're building care plans creative in a way that, that's a way to crack up the industry. So we speak about also substitutes exist. When people are very poor, they have a lot of power. So the buyers have a lot of power. When people are very poor, they have a lot of power because they don't spend. That's the power they have. Threat of new entrants is very high. Hospitals everywhere. You see, post-COVID, we thought that the biggest place to make money is in diagnostics and pharmacies. Yours truly did set up 3 diagnostic labs. I did myself. I set up 3. We thought there's so much money to be made, but you see that you have to do the work to make the money. So consumer income declining. One of the things I want us to bear in mind is when GDP per capita is below $3,800 or so. I saw that report somewhere. Healthcare is not priority. So note that, bear that in mind. I don't know where our GDP per capita is. It's somewhere nearer to $1,500 or $2,000, maybe $1,000+ if you use the current conversion rate. So This number, we set up our healthcare businesses based on these numbers growing. That's the assumption we have. But they do not tend to grow the way we believe they should. So a couple of other things. Let's just go to this. Nigeria's median age is below 20 years. Healthcare is not priority for your sons and your daughters. It's not. At 20 years, no, it's not. Life expectancy at 60, just as healthcare is going to become priority, they are dead. That's something to bear in mind as we build our healthcare businesses. And I think a doctor, a very important, a very big doctor in Nigeria said something to me. He said, Chidi, the reason we seem to have succeeded with COVID was that all the people that COVID would have taken died before COVID arrived. That was interesting. I mean, it's a doctor that everyone will know. We don't have to mention his name. The other thing impacting healthcare is migration. Some of our more accomplished, they migrated at above 50 years of age. I have many of my friends. We graduated almost 40 years ago. They live in the country 4 years now. And sometimes I wonder, these are the guys that will be on chronic disease medicines. They don't live here anymore. A lot of them are leaving. The competition is value destroying all over the place. Setup cost is high. Foreign is better. Medical tourism may be beyond not finding it locally. Let's bear this in mind. When people go out to do this stuff, I mean, I had a friend of ours died of prostate cancer. Apparently, he kept traveling overseas. He spent £50,000 to come and do the operation in the UK, to go to the UK. And I told him, you could have done that in Nigeria a year before. Eventually, he died because the doctor said he read, it's unplanned for, it's unbudgeted for. And regulatory matters, we'll leave that for another day. So a couple of other things to bear in mind. We need to understand the difference between growing and scaling in the healthcare industry. I speak with a lot of healthcare practitioners, both hospital owners, diagnostics, people who run HMOs, pharmacies. They believe that growth is carrying so much cost and our cost is rising. We are not going to scale profitably. Very important. And the practice. There's a huge difference between the business and the practice. So all of us should bear that in mind as we try to build a business out of this. Revenue is certainly not equal to profit. The work needs to be done to build business models that fit. So you can see healthcare spend is rising, is growing. Access is growing. Telehealth is also helping that. Preventive care, certainly. There's a redefinition of healthcare happening. If you operate in certain parts of Nigeria, beauty care is actually healthcare. That's the way it's seen, and you see, and desire for wellness is also there. So let's go some of my thoughts. How do you build a profitable business? Remember, I said we water the ground. We give a few thoughts. Is the business right? The first thing we need to think about is the business model. It has to be right. If you don't have a business model that's very clear, which customer, which product or service, how do I get differentiated in the marketplace? You're not going to build a profitable business. I'm afraid in the healthcare industry, we open stuff hoping that the customers or patients walk in. There has to be a clear business model, and that desire a lot of rigor to build. The other one is marketing. I think Ugo mentioned that. How are the HMOs doing their marketing? Putting a big billboard out there is not market. Marketing begins from understanding the desires of a customer group you want to serve. In the healthcare industry, it's not happening as much. Another one is partnership, collaboration. I'll share an experience with you. So I built a lab and I built a pharmacy, and a doctor also built a clinic around us. But within that community, there were about 10 other hospitals. There were, 3 other labs. Every hospital built their own lab and pharmacy. That's what happened. They all tied up their capital. Okay? Every lab wanted to dispense medicines. Every pharmacy wanted to own a lab. All of us, 15 of us, were losing money. I had to bring everybody together. And today we started to see money being made. Partnership and collaboration is very important in this industry. Technology is another big player, but technology is an enabler or channel. It's not the business. In hospital setting, in diagnostics, in pharmacy, HMO, trying to scale very bad proposition through technology. Technology is only an enabler. It's a platform. It's a channel. It's not the proposition. Bear this in mind. The other one is innovation. There are markets that no one is attending to. How do we capture them? These are conversations we need to have. The other thing healthcare has to do is to learn from other industries. what can healthcare learn from FMCG, from telecoms, from fintech? Is there something we can learn from them? So these are some of the thoughts. One of the things I believe we need in healthcare is a rethink and shift in mindset. So that's key. So finally, to evolve a sustainably profitable healthcare business, if you want to be sustainably profitable, you need a rigorous and holistic approach. There has to be a clear business model. You have to have the capability to execute the big plan you have. The strategy has to be right. Which customer, which patient type, what services, how do I differentiate myself, and how do I continuously deliver this service? That's very important. One of the things I want to leave us with, economic and social issues will continue to impact our sector and its profitability. Sometimes negative, most times negative. We must bear in mind that healthcare is competing for share of pocket with the guys who sell beer, the guys who sell laptops, the guys who sell phones. We're competing with them. How well we compete depends on our ability to build business models that attract more footfall onto our facilities, whether online or offline, and also build the capability to last the marathon. I think that's a few comments I wanted to make here. Thank you very much.
Awesome. Thank you very much, Chidi. Thank you very much for providing the insight. You talked about the assumptions that we make within the sector, and you hopped on the Porter's 5 forces, not knowing our competition and delving into areas without having a full understanding of what's going in. Very interesting look at the demographics, the median age of less than 20, not very interested in health at that point. Our life expectancy less than 60, it has a consequence, and the migration for the skilled workforce above 50 that leaves for a different climb. Our set of costs are high, and we have a mindset shift that is very, very necessary for us to look very closely at, where for quite a few people, foreign is sometimes perceived as better. And for us to fully understand the difference between growth and scaling. Growth is not equal to scaling, and revenue is not equal to profit. So in order to be profitable, we need to reinvent the wheel and the way we think and the way we manage some of these are issues, and look at having more winners than losers, and making sure that we have business models that fit, and look very closely at the rising spend in healthcare, which has been mentioned before, and have a rethink with clear pathways to the business that we are in or want to go into, making sure that there's financial sustainability, rethink around marketing, partnership, collaboration, the use of tech as an enabler, innovation to capture other markets, and definitely to learn from other sectors that have succeeded, whether be it fintech or the telecom or the fast moving consumer goods. So thank you very much, Chidi, for that. And I'll go to the chat group. Please, if you do have questions, send them into the chat group and we will address as many as we can. I think some have already been answered, but there's a question here from Yvonne that she says, I understand that the share of pocket and spending has increased in the healthcare sector. It would be great to get more specific sense of where that spend is going. Is it to purchases in an outpatient care or insurance premiums? I think Ugo spoke a little bit more about that. Ugo, could you take that question, please, sir?
Sorry, what's the specific of the question again?
Where the spend is going to.
That's the
I think
same.
you spoke a little bit, where the spend in the sector is going to.
Is it, what spend is it specifically asking for?
Sorry, she said, I understand that share of pocket and spending has increased in the healthcare sector. It would be great to get a more specific sense of where that spend is going. Is it to purchases?
Interesting question. I get it now. Not so sure because it was a data that was out of a survey. But I mean, circle back with me. I could find out, and then I'll let you know. You can circle back. I mean, check me on any social media handle @Ugodre. same handle at Ugodre, either on X on Instagram. I would give you that data if I find it.
Okay, let me see. There's another question here. From Dr. Shaibu. Thank you, Dr. Doim, for your presentation. Always great listening to you. If you are to suggest areas of investment, in the health sector value chain, where will it be? Hospitals, big pharma, dispensaries, specialist hospitals, health insurance, or where, sir? Dr. Salami.
Well, I think this is probably punching above my own weight, given that I think probably best that Chidi should go at this, but I will have it a punt at it. If I'm investing, I would actually probably go in the direction of what do you call those things? Diagnostic centers. You see, Chidi made a very interesting point about having set up diagnostic pharmaceuticals, and then they all found themselves clustered. But that's the important, or that's an interesting characteristic of business in Nigeria, not just healthcare, where people see somebody somewhere and they are clear that, okay, there's demand here. So everybody comes at that. As I drive, for example, out of Lagos, there are large swathes around, once you drive past Mobile, that Mobile filling station, at Alausa, and you're headed towards Mowe, Ibafo, and all of that. There are large swathes of population there. And you actually, I actually on one occasion had to go around, and there are very, very few. There are many clinics, but very, very few diagnostic centers. And my own personal interest would actually be in diagnostic centers. But as I say, this is not, I'm a macroeconomist. I would rather those whose daily bread, like Ogachiti, emanate from this sector would probably be best. But I would certainly, without any doubt, say diagnostic centers.
Okay, thank you. Chidi, would you want to add to that response?
I think across the value chain, you do have opportunity. It's about the business model that you can knock out. It's not about, it's across the sector, diagnostics, even nutrition centers, you can build that. That's also part of the value chain, hospital, pharmacies. Across the value chain, there's big opportunity. It's about what model can you build to take the opportunity, and what's your revenue cost model? What revenue cost model will work for you? Like I said, healthcare is competing for share of pocket with everyone, with telecoms. They spend on telecom before they spend on their health. So how can you move part of that? How can you increase the share of pocket? Coming to your own center. I will not say this is the one or that is not the one. It's about what business model would work and be successful.
Okay. Thank you. Yeah. So there's a question and a comment from Ndukwe. There is news of the federal government suspending tax and VAT on imported pharmaceuticals. How much of an impact will this have in our healthcare, knowing the complexity of the financial system? The NHIS has not really helped in driving low cost or reducing out-of-pocket spending for Nigerians. How can we increase health insurance in low-income communities like in Nigeria? Ugo, would you like to take a bash at that?
Let me try and take that. So, intelligent question, smart question there. So when government says they want to reduce remove VAT on pharmaceutical products, the whole idea is to help reduce cost of buying those products. And as we all know, consumers are the ones who pay VAT. And so by taking off VAT from cost, the hope is that that saving will be passed on to the consumer, which is a pretty good move. Now, whether that actually now ends up being reality is a different thing. Let's remember that VAT is just an aspect of the entire cost of a pharmaceutical product or a healthcare product. And at the end of the day, the ability of the company or the, healthcare provider to pass that cost through also depends on whether the other cost inputs that, all make up the general cost remain stable. So if their own cost continues to rise, and then even though the government has taken out that VAT, doesn't necessarily mean that cost of pharmaceutical goods will remain the same. So it's a good move, but I'm not sure that it's going to give you this sort of impact that you expect. You only get that impact when we start to see stable prices. But if we continue to see the sort of volatile prices that we're seeing, then you might not feel it that much. But still a welcome move by the government. In terms of HMO, what I've seen is that like I mentioned earlier, a lot of state governments trying to catch in on this health insurance scheme because they come to realize that they can't fund health insurance from their budget. So typically what used to happen before is state governments just come out with the budget for healthcare and then build 1 or 2 clinics here and there, and then they think that, they provided healthcare. They've realized that you can't do it. So the way it's done conventionally across the world is through health insurance. And so you have to find a way of getting civil servants and citizens in your state to all contribute towards a health insurance pool. Now, it is when everybody contributes into that health insurance pool, the way it works is that through health insurance and everyone paying a premium, you can then fund cost of healthcare. And then that's economies of scale that it provides can then reduce healthcare costs. And then even at that, government can even still contribute, but then they're not going to have to contribute as much as they used to, or they'll channel their own funds at areas that are better useful for the healthcare sector. So that's what a lot of states are doing. I think it's still pretty nascent. They haven't really started it. They haven't really implemented fully, and I think adoption rate is still very low. But I think it's in the right direction, and so I'm happy that at least more state governments are keen into this, and then let's hope that continues to happen.
Awesome.
The way to make it work is to enforce it, and I think that's what they're trying to do now. Some of them are also codifying.
Thank you.
Yeah.
Thank you very much. We have a question here. I'm sorry, I'm not going to be able to take every question because I know Dr. Arinze is going to have to make some comments about the healthcare initiatives. But there's a question here from Somadina, which says, give more perspectives on the impact of out-of-pocket expenditure for healthcare need. The impact of out-of-pocket expenditure for healthcare need. Dr. Salami?
Well, for me, there are at least 2 dimensions that you can come at that from. The fact that out-of-pocket expenses out-of-pocket expenses means that if you end up being ill at a time when your pocket is lean, then you got a real problem on your hands. And that is really where the point about insurance, health insurance comes in. And for me, I think many state governments owe a responsibility to the populace to actually make more of their own capacity to pool large numbers and reduce the cost of premium. That really is where for me, but they haven't, in my book, done pretty much nothing in terms of trying to explain what health insurance is about, trying to pull this kind of, it's an actuarial game. The larger the number of people, not all of them are going to fall ill at the same time. It's a very simple concept. And for me, we cannot continue to rely on out-of-pocket expenses. And indeed, one other point that, look, the more you can streamline capitation, you can then use capitation to enforce quality. It's just a shame that we don't seem to understand how some of these things kind of link into one another. So those would be the 2 perspectives from which I come.
Thank you very much. Chidi, this is for you, and this will unfortunately be the last question. I want to ask which collaboration will be best to engage in terms of profitability and accessibility of healthcare, national health insurance or NGO collaborating with community pharmacy, and how can you go about it? That's from Hafsat.
Okay,
very quickly, please.
First, one of the things I like to do is to meet the customers where they are. That's a saying I typically have. Health insurance will come. It will take a while. It will take a lot of redesign and creativity to get that. So in terms of collaboration, if you notice, every hospital is building a telehealth center. Every pharmacy is building a telehealth center. Every diagnostic. So I have been contacted by a set of hospitals at Satellite, and I said to them, do not waste your money building a telehealth center. The infrastructure is too expensive. Can you guys build one infrastructure and then spend the money trying to win patients onto the platform? Very simple. I also said that to the pharmacies. Don't build individual. Build one for Satellite, one for Festac, one for Ibadan, so that people tie into that. In that way, you save the money on brick and mortar infrastructure. Because at the end of it, the software is sunk cost. Now you put the money to attract patients onto that. There are different collaborations you can have. It can be community. It can be non-government agencies, the churches, the mosques that come together. It happens in some states where they actually run the health center better than government would. There are millions. Even big corporates can also get into health. I understand. I think Dangote Foundation, they're getting into health. IG Mokwe, they got a foundation going into health. Collaboration is endless, but even within the community of practitioners, so when you have the lab science, the pharmacy, the doctor, in an area, say we collaborate to grow our number from 10 to 15, rather than fight to kill the number from 10 to 5. This is we're out of time.
Thank you. Thank you. Dr. Arinze, very quickly, you have the floor to talk about the healthcare initiatives.
Yes,
Dr. Arinze?
Yes, can you hear me? Thank you very much.
Yes.
So I'll just quickly share my screen just to talk about what we're doing at LBS regarding the healthcare initiative. Please let me know when you can see my screen. Okay.
We can see it.
Okay, thank you very much. So what we are doing at LBS is basically focused on 3 areas. The main thing is to provide healthcare business management programs. The second thing is to impact positively on the healthcare business in Africa through advisory and thought leadership. And the third is to make intellectual contributions in the advancement of healthcare in Africa through quality research. Now, by Q1 of next year, we plan to roll out 3 programs. One is Scaling Your Healthcare Business, which kind of focuses on owners of healthcare businesses, whether they are founders, CEO or CEOs of mid-sized companies in healthcare. And then the second one is regulatory affairs as a growth pillar, because we believe that regulation is important for your healthcare business to grow, to understand what is the next government policy towards healthcare. So we are targeting directors and managers of food, pharma, and cosmetic companies, and also any healthcare professional that is interested in this area. Then the third product that we're going to deploy next year is marketing healthcare products and services. So in this, we, based on also what the panelists have mentioned during the webinar, that we see that marketing is key for healthcare businesses. So we're looking at investors and operators of medical facilities, be it hospitals, pharmacies, diagnosis centers, physiotherapy, and the rest. So these are the programs that we're going to run at LBS next year. And then if you want to make any inquiry, please, you could contact the 2 people that you see their details on the slide. Tayo Fulayo, Mr. Tayo Fulayo, and then Mrs. Bumi Aritiche. Tayo is in customer education at LBS, and Bumi is the Senior Administrative Manager at LBS Healthcare Initiative. So thank you very much for that. And
Thank you very much.
Thank you.
Okay. Sorry, you wanted to say something?
Yeah, I just wanted to thank the panelists, Dr. Doyin Salami, Ugo Obichukwu, and then Mr. Chida, and also Dr. Monica for moderating the sessions. Thank you.
Thank you very much. And we also appreciate those for joining in and participating. Thank you all very much, and wish you all good morning. Thank you.
Thank you very much. Thank you very much, everyone.
Thanks everyone. Bye.
Thanks.